Hello, everybody. And now see where's my share the screen go? Oh, there we go. I hope you can all see that. I think we've got a few people here now. As previously, if you can all keep your microphone on mute, unless you have any questions to ask, that's very much appreciated. No problem with you interrupting if you want to ask a question there and then, which might be more on topic rather than waiting to the end, or we'll go through things at the end. I can't really see the chat easily, so if there's anything, if somebody could flag it up to me, that would be great. So welcome everybody to this Wednesday's Small Animal Medicine Educational Hub event, not the hug event that I promoted on the email. Quite funny that only one of you have emailed me about it, but whoever wants a virtual hug, there's one here for you. I'm a very huggy person, so that is absolutely in it if you would like one. So today, it's a bit of a shorter topic, but still one that I think is quite important, how to get most of your vet out of your vet consult. And the reason why I felt that is quite important is that of the referrals we get, there's a proportion, obviously, that are the more complex cases. But there is absolutely a proportion that when you have the time, and I explicitly say when you have the time, because I appreciate I get more time to prepare for a consult, to do the consult than you guys do. But when you have the time to do the consult, and obviously I've got the history written down, that sometimes there's straight away things there that are either written in the history but not taken forward, or topics that were not asked for, which were key to then to develop the case and make a final diagnosis and treatment plan. So I'm just going to give you some hints and tips on what I do. A lot of these you might already be doing, but definitely I think once you are out of vet school and in that consult room, you don't get anybody to watch your consults anymore. And sometimes it would be nice to have somebody to observe you. And even with some of the vet students at the end of the consult, we go and ask, well, is there anything else you want to ask? And people sometimes do come up with other questions that you haven't even thought about or you hadn't clicked in. So I'm just going to share with you what I do. By all means, take it or leave it. There's no science in this. But that's where we're going to go and what I think is important. So how I structure the talk a little bit is around a new problem consult. So obviously you might not always know that it's a new consult, but I mean, not a vaccination or a recheck or euthanasia, which are completely different consults or a new puppy, really. So we're talking about a dog or a cat presenting with a new clinical issue. And there's three main topics within the talk today is how do you engage the owners, get them on board, which is very important. And I'll explain to you why. Getting most of the information out of them, and ideally most of the valuable information. There's some owners out there that definitely share other things that aren't necessarily of any intellectual value to you, and how you're going to use that to enhance your workup and your diagnostics. So I think within the consults, there's three main parts really: the emotional part, the information bit, and then hopefully the confident part where they're leaving at the end. So when I talk about the emotional part, how I very much envisage this is when an owner comes into your consult with a sick pet, they have been worrying and watching this sick pet of them. And some of them will consider them as their relatives, their children, but been watching them and worrying about them for some of them minutes, but most of them weeks till days. They're trying to make sense of it, but they can't help this pet themselves, and that's where they're coming to you for. So they are quite under an emotional stress level from where they are. The pet is emotionally stressed because obviously, I mean, it's probably not feeling 100% anyway. It's been either in a car, dragged through a consult room with lots of other stressed dogs where the pheromones are going around and it knows what it's there to do. Because whenever it's coming to the vet, it's not for a party. The cat's been in a carrier, been shaken over a road, and normally it doesn't go in the car. So again, that animal is quite stressed from the start. And if we're going to ignore that bit, it's going to make our clinical exam a lot more difficult. And then sometimes as vets, and I still have that, even though I get the history to read through before, as vets might be quite, maybe not stressed is the word, bit of nervous and not knowing what's going to come our way in that consult, because each time it's a new consult, a new beginning, trying to make it through, get as much information, get to the end and restart again. So it is draining, it is intense, and take into account that all three of you are not there like you would be in a pub and chilling out. Okay. So I think it's quite important that you try and break the ice and at all times be empathetic with the owners because they are worried about their pet. The second part of the consult, very much the main part of the consult, is then trying to get as much information out of them. As we said, I think these owners have been watching their pet, your patient, day in, day out, every minute of the day. They've got the knowledge of what is normal for this pet, and they know or they can see what is now abnormal, but they can't put it in perspective. But they got the information. Some of them are easier to get the information out. Some of them need a bit more pushing and pulling, but you want to get the valuable information out of them. There's no point in being in them. You want it on your screen, in your notes, in your mind, really. And that will take part of active listening and then identifying the problems really and going further on to them. And the end result is very much that the owners are leaving with some confidence in you. They believe you understood their problems. And that's a bit, you might have found other problems, but acknowledging their concerns is a big part of your issue, because if you don't, they might not see what you see being the problem. So you'll have to try and relate to them and explain it to them. And then you can combine that with your concerns and come up with a treatment plan. So if we look at the consultation and just spread it out a little bit further, let's talk about the intro bit. So as we said, be welcoming, try and break their ice. What I often ask people, but again, people travel from a bit further. Did you find us all right? Was traffic all right? Just something that's completely irrelevant, but enough to just get their mind off the worrying bit. Okay, something they can easily answer, something they can get into the mind of, yes, this is a normal conversation. Let's start. Think of it as a date. Let's start the date off here, really. Introduce yourself. I think one of the tips as well, acknowledge everybody, even if they're kids in the room. Owners like to, obviously, owners of the pet, but parents love their children. Acknowledging their children will help you along again at gaining that trust. What I often will do as well is getting the animals to roam free in my consult room if there's no windows open. So let the cats out of the carrier, let the dog off the lead if it's safe to do so, for the reason that they will settle down more when they can go and have a sniff around and have a little look around. The cats might not want to come out, but that's fine. That is their choice. It's something different than us straight opening the carrier and getting them out to be examined. So get them to relax as well and try and break down those anxious barriers as far as you can, because that will help you further in the next step. So then the next bit of my conversation that I will go to is just rather than going straight to the problem that they're there for that day. And obviously I already have some knowledge from the history, what they're there for. So even if you ask, well, what you're here for today, my dog's been vomiting, then take a step back and maybe start asking some general questions if you do not know the patient well. So are there any other dogs he's been in contact with, be it in the home or on walks, on close contact with friends that are sick as well? Is there any chance he could have eaten anything, or what is his normal diet? Has he had any problems like this before? Is this a recurrent problem, or is this a first occasion? Have you tried any medication or supplements? Because often they won't necessarily volunteer that information, but if they do say anything, or are they on any medication? Are they on non-steroidals? There's lots of questions there depending on the problem that you'll want to know about. Okay. as a more general lifestyle issue rather than the specific vomiting issue where you're going to, because that is second line. But straight after, when you have a bit of a baseline picture, have they got worming medication? Do we do this regularly? Just think through what things could influence you dairy. Then go to the specific problem gradually. So if we're talking, for example, vomiting, well, how often are they vomiting? One of the questions that I think is very, very important is, when did this all start? And even if they say, well, he vomited first yesterday, that is fine. But definitely if you think there might be a more chronic history, then ask them, well, when were they last normal? Because that is completely different to when the problem started. Because it could be that the dog's gradually gone off his food, first of his own food for the last 4 weeks, and then they had to tempt him at new food, and now that he only eats human food. So, and the last 2 days he stopped eating, and then now he's vomiting. But that period of nausea is obviously a progressive period over those 4 weeks' time, but it's a lot longer than he vomited once yesterday. And unless you go back to try and question them on that, they might not think that's relevant. They do not know that's relevant, okay? Because a lot of people will not necessarily link the two together. You'll want to know, what are they bringing up? Are they bringing up anything after eating? You might want to ask them about more signs of nausea, or are there any other signs of diarrhea or other GI signs? Are they uncomfortable? And abdominal pain is often a hard one to assess in dogs and cats, and from the owner's point of view. But you could ask them, can they jump on the sofa if they're allowed to? Can they go up the stairs? Can they get in the car? Because those are all things, if you have a sore tummy, you can imagine that can be quite uncomfortable. So initially, you want to start with the more open questions and let them talk as much as you can. But now and then, you might want to drop in and ask a bit more detail about what they've been talking about. Or if they are in a run of talking, just write some keywords down so you remember when they have finished that you can go back and just fill those little holes in. Out of that, you want to identify your main problems really, and then ask some closed questions to get some more detail if you think that's the right thing to do or what they haven't answered yet. Okay. And you might come up with that straight away before your clinical examination. You might come up with that after your clinical examination, but keep that in mind. Keep your brain ticking over and just making things a more cohesive problem list there, really, what you come out with. Okay. So that's your initial historical problem list. And out of that owner info, and you're already observing this patient, and now this patient's been off the lead for a while, has it shown any signs of licking his lips or gulping? Does it seem uncomfortable? What's his breathing doing now it's settled down? Those are all things that are a lot easier to assess in a free patient, as far as you can let them free in a consult room, before you go to the clinical examination. Okay. So I'm not going to talk in too much detail about clinical examination. I think I generally go to very general clinical examination, depending obviously on the problem. Then you pay more attention to certain areas. If it's a breathing issue, go more towards the thorax. Never ignore the abdomen. If it's more a vomiting diarrhea, we go more towards the abdomen. But general clinical examination can give you extra clues. What are those lymph nodes doing? I mean, the times that we have seen, even in our practices, neurologists doing a full MRI to find out that a dog has big lymph nodes and lymphoma, it's not unheard of. Doing a good clinical examination will pick you up some relevant things, but potentially also some incidental findings. Definitely in older patients, both on the clinical examination or further imaging, you could find incidental findings around the blood. But you want to have a good look and a good feel over this patient and find out what is relevant. The bit I always do as well, I take a little bit advantage of, is I use my stethoscope for quite a reasonably long time. I don't sitting there for 5 minutes. But first of all, with your stethoscope, obviously have a good listen to the chest, to the heart. If it's coughing, to the trachea, is there any upper airway noise there that might be referred noise, what you're hearing in the chest? And then I might go back a second time and do the whole cycle again. And that's not necessarily because I didn't hear it the first time. that is because that is my own space and I can think about things a little bit more clearly because owners know I can't hear them. So they're not trying to talk to me. And at that point, you can formulate some thoughts in your brain in which way you want to go. So it just buys you a bit of your own time within a busy, stressful consult room. Just get your thoughts a little bit more structured and what do you think is relevant? Are there any other questions you need to think about before you then round up? So at this stage now, take the stethoscope back out. And you start having a chat. Now, if there are any other issues or any other questions you want to ask people, this is the time to do it because they might have come up while you're examining, or you might at that point also find, well, they got a murmur. Have they had this before? And oh, yeah, that's been noticed for a long time. Or have they got any issues with exercise tolerance if they've got a murmur? Have they got any coughing? There might other things that have come up from what you have found. And I would always explain to people, I mean, either this clinical examination is absolutely normal, but that doesn't mean anything, or these are the things that I have found, and that might or might not be relevant. Okay. What I will always do as well, and probably at this stage or just before my clinical examination, is just mention their concerns back to them. So I will, for instance, say, now what I've heard you say, and please interrupt me if there's anything I've forgotten or if I got it wrong, is that your dog's been vomiting for the last 24 hours, but he hasn't been eating well, and that has got gradually worse over the last 4 weeks. He is a scavenger, but you haven't noticed any toys missing, for example. But I will always relate their concerns back because then, one, they will feel listened to. You have understood what their problems are, what their concerns are. And two, it gives you just that backup plan. If there's anything that you have let go, that you didn't hear clearly or didn't put any importance to, they have that extra point where they can get in there and add into, yes, but this is also a concern. So always check, is this the whole picture I got? Is this what you're here for today? Okay. At that point, you might say, well, that's fine, I've got that, but I have also found in my clinical examination this or that, or I think that this is more important than what you initially thought of. Because he might have a bit of a skin rash, but you might think that that is quite an important finding in the whole set of things. Okay. Sometimes, at this stage, it's sometimes a bit difficult, your visual aids, unless you have a very clear picture of what is going on. And trying to explain things to people, even if you make a little list of the problem list on a whiteboard or a sheet, just so they can visualize it better. Some people understand things easily when they hear things. Some people want it written down. Some people like a drawing. You don't have to be an artist, but it's just helping them understand what you're coming from. Because what you want from this point is that they are confident that you have got the problem, you got the best interest of their pets at heart, and what you're gonna suggest to take it forward is likely the right plan. Okay. You're going to prioritize this concern. What is more urgent? What is less urgent if there's more than one problem there? Okay. And then you want to go through, well, this is the treatment plan now, or the investigation plan initially, if you still need investigations. And it's up to you to try and explain to them maybe, well, this is the gold standard plan, what I would like to do, but this is what it's going to cost. And that's what the time is going to take. However, maybe we can start with this and go further, or would you like to rather have everything tested at the same time? Where are we? And it is very much, I mean, the buzzword of today is the contextualized care. And I do believe contextualized care is very important. And that's what we often till recently have maybe been forgetting in referral centres. And I don't know, possibly primary care as well, because we've all been trained very well what the gold standard is. But a gold standard can be very expensive. And there could be a plan B that there might be some things that you might be missing out of, but it might not be that relevant in this case. But unless you discuss this with the owners and let them make their own choices, what they believe is important, then it might come back to bite you. Because if you make the assumption that they don't have the money for plan A and you go for plan B, but plan B doesn't go okay, and you have to then step it up, they might be a lot more frustrated than if you explain the options to them. Together, you make a choice which is the right one at this stage. They're fully aware what the shortcomings are of this option, but what the potential is, and they're happy to go with that and then go from there, really. So I think that leaves you with the best possible solution for both of you that they are happy with, because in the end, they'll have to pay for it, and that will take you a bit further, but there might be some shortcomings. Okay. Same with a treatment plan. If you say with this vomiting dog, well, let's try anti-nausea treatment if they don't want to do investigations. However, we're only going to do this for 3 days because if there is something underlying, we need to do further investigations. Make a concrete plan. Say, well, that's fine as an option. Let's take that option. It's not the ideal option, but there is a chance it will settle down. So let's do that. Let's do your diet, change it to something more bland, but put a time frame to it. Tell them that if it's no better by 3 days, 5 days, whatever it is, come back. Or if it gets worse, I want to see you back. Put some points in there. When do you want to see them back? And put the responsibility back to them to get back in touch and give you an update. And it might be you say, well, even let me know if things are okay, but tell them to make a plan. Okay. So at the end, you want to leave in the ideal world. And again, I know time isn't always on your side, but you want to have a prioritized problem list in your head or on your notes. You want to establish the next steps and when they're going to happen. Not everything has to happen today. If you go to the carriage to talk to them that your car is rattling a little bit, they're not necessarily going to take that car in today. Obviously, it depends a little bit how urgent the problem is, but discuss with them what the pros and the cons are. And you might have a reason the dog might not be starved, so it's not ideal to do it today. Or there might be a reason that you do want to do it today because the pet is a lot more poorly than what they taught, and you explain to them why you believe that. So explain to them what the next steps are and when, or do they want to go home and think about it? Thinking about things is something that I will often do, even with the referral patients. So say if they're coming in for, I don't know, say that patient comes in and we do find something that we need to address, but it's not urgent. I'm not talking about an urgent reason of vomiting, like a foreign body, but something that can wait a little bit longer. I will give them the information verbally and I will send them home to think about it. And we'll tell them, give me a call tomorrow, because some of these things you do not want to decide in 5 minutes. It's a very emotional situation. You probably told them some new things as well that might make it even more emotional. And you need some time to put your thoughts straight, or they need some time to know what they actually want to be doing. If you want to hospitalize the patient, make sure for both for yourself and for them, why do you want to hospitalize them? What is the benefit of this? Because just putting an animal in a kennel does not make them feel any better. Okay, so make sure why do you want to do it and how that's going to make a difference to that patient. And as we said, if they do go home, identify some touch points. What do you want to happen? When do you want to hear from them? Who's contacting who? Are you contacting them with results or are they contacting you with an update? So you want to make sure that they are leaving with a feeling that you have listened to them and you understood their concerns. Even if you found different concerns, they still feel listened to. But as a professional, you identified other concerns which might be the cause of the issue and they understand that. Okay. And they leave with a plan and it's clear to everybody. So I think where things go wrong, and I think definitely in those bits, the emotional stress not being necessarily recognized, but you're going straight into the questioning and they are emotionally not ready for that. Therefore, they cannot get the information out what's in their head, or and they start being worried about what's happening. Not asking the right questions and a lack of details will put you down the wrong path potentially. Or even if it's down the right path, it will take you a lot more money and more time to get to the answers you need. Disjointed problem list. And it's not always easy to do a problem list clearly, but definitely with the more complex patients, I will take it after the consult, sit down and write through a problem list. I will do a list of the history with the findings and things there. And if you get a referral letter from me, the top bit will always be a summary of the history. And that's not necessarily for you guys to read through, but it's for me to summarize my thoughts as well. Because sometimes things come up in there that when as I'm writing them down, my brain will process them differently. Okay. You want to explain things to people in a language that they can understand. They don't understand necessarily our language, our medical jargon language and the words there. You want to explain it to them simplistically. I mean, one of the things I explain to owners is a bit like portal hypertension. Why do they get ascites? And we explain it with a drain. And if you block the drain off, the water has to go somewhere. It'll overflow. And there's just simplistic and maybe oversimplified things, but that people can understand and they can take that forward because that might help you with your treatment plan. The more they understand when they go away, the better owner's going to be at picking things up that they might report to you. Tell them what you want them to look out for. It's for us to give them the information because they don't necessarily know this. There's things like puppy classes, but there's not a basic health class that will explain to owners this is what's normal, this is what's not normal, this is where you feel the heart, this is keep an eye what is normal for your dog and check this, that, and that. And if that's abnormal, let us know. If your dog's breathing funny, let us know what it's doing. Take a video. Let advise people. We all have cameras on our phones. Take a video. Be your eyes and ears, really. But if they leave without confidence and trust, that's where your whole treatment plan is going to be wrong because they won't call you when it is wrong or when things change. They won't inform you of things necessarily in the right way and they might go elsewhere. So that was just about, I guess, just under half an hour. But yeah, I think I can't stress enough how important that first step is because, as the same with the first date, it is your first chance to make an impression. And that impression, unfortunately, if you get it wrong, it might take a lot of effort to get it back right. So there's some simple steps as gaining their confidence and things there that can help you in getting the right outcome. I do appreciate that you do not have as much time and that your daytime can be a lot more stressful. But if you make appropriate notes and problem lists, the problem that comes in at the re-examination will be very grateful to you, and that might be you as well. And as a practice, if you get into that habit, it will speed things up on the long term. So either way, I think that is the last bit from my talk. I just wanted to put this up as it's last week. You can sign up to the waiting list for the anemia course. And if you sign up, you will get an email over the next week with a better offer that will be offered to everybody else. So if you want to sign up to the waiting list, last week going, and then we'll go from there really. So, and then the last bit I'm going to finish off it is that there's no talk next week. I'm on a conference in France, but we will then pick it back up to weekly the week after. And on the 11th of September, we'll talk about lymphadenopathy and explore a little bit how to investigate with the new tests that are available and how to interpret everything. So that is me for today. I am going to stop sharing, hopefully, and see if there's any of you that would have any questions for me or that want to anything to clarify. Thank you, William. That's very kind. Thank you, Ayub. You must have a question, Ayub. You always have a question for me. In a good way. Don't take it bad. No. Thank you, Ellie. I'm assuming, I guess, I don't know, what do you guys, I know in the UK, most people get, I think I'm right, about 15-minute consults. There's some places maybe 20 minutes, and the rare one, I hope, 10 minutes. What do you guys have in the rest of the world? Do you have a set time for consults, or do you guys It takes as long as it needs, or what we're talking about. So yeah, I don't know, I think that is 15 minutes in the UK. Yeah. Make the vet dispense the meds. Yes, that's the problem. And quickly do the anal glands and cut the nails. I think it's one of my bugbears in referrals as well, William, that I have to go and dispense my meds. Most of the time, it's not a big deal, but when you're on a tight schedule, it does make the difference if you have to start counting out 156 Brett tablets. So, um, yeah, it's not ideal because those are the things that you think, well, it only takes me a few minutes, but if you have to do that 10 times a day, 3 minutes is half an hour, isn't it? That you could be doing your notes or something else or grabbing a drink in between consults. I'm not sure if anybody from any other country would like to share with us. And if you miscount the tablets, yes, that's very true. If you miscount the tablets, that's one thing I guess that not on the tablets, William, but that I was going to say. I think what a lot of people will do, and maybe I'm not going to say I'm bad at that, but as an intern, I always, when we had 40 patients to check between 6 and 7 and TPR them, I guess your temperature you can't guess, but your heart rate, you could count for 15 seconds and multiply it by 4. Or you can listen to it and you can get pretty good at saying, well, this is 60 beats a minute, or this is 80 beats a minute, or this is 120 beats a minute. Nobody cares if it's 84, if it's 88. Nobody's going to care about it. So sometimes it's better to start having a bit of practice. I'm not going to say guessing, but it's a calculated guesswork because that's the relevant bit. And just the number doesn't really matter. It matters more, is it a regular rhythm? Are there any pulse deficits? What's breathing effort matters more than necessarily if it's 20 times a minute or 24 times a minute. Okay. So, but yeah, miscounting tablets is a tragedy. But you might never know till they come back and told you, I guess. But okay, well, if there's nobody else, oh, you thank you. You give it 30. At the end of the day, that does add up to quite a long day, then, I assume. If there's nobody else who wants to ask me anything about consulting, then I'm gonna thank you all for joining me. I do enjoy these sessions. I hope you do too. Um, I hope I see many of you in 2 weeks' time, and I might even do a session on what we learn in the conference. But let's see what it brings on. Have a great time. I'll see you in 2 weeks, hopefully. And oh, Olan, how do I deal with difficult clients? Oh, Olan, what do you mean with difficult clients? Do you want to come and talk to me? I mean, on here, I mean, because there's difficult and there's difficult. There's difficult clients who talk too much, who are not necessarily difficult people, but who want to share their whole life with you. Which you try and regain. Clients that know much more than you. What from Google, I assume. Well, I think I would acknowledge what they know and I would acknowledge where I think they're coming short. Uh, uh, I would probably, I mean, if you think they genuinely know more, I think often with clients, I'm trying to believe that it comes from the right place. They are worried about their pets. I mean, when I worry about myself, I might go to Google, maybe, and just do some searches, maybe a bit more pointed than the general public will do. But there's a lot of Google and there's a lot on there. I use Google every day to find, but you need to know where you're looking for. And there's definitely lots of things on there that are not true. Anybody can put whatever on the internet and it'll be on there forever. So I guess I think it's regaining their trust. And if you listen to them and acknowledge their knowledge and either tell them why you think they are wrong on this or why they think that you might be right, but you need to confirm it, then that might help. But I think every client is slightly different. and they all have their tricky bits. There's the ones that don't give you any answers or that just stare at you and don't talk. There's the ones that completely talk past the issues. They're the angry ones. Most of them, it's all driven by an emotional situation. If you can try and settle them down, then a lot of these people will get easier. Not going to say easy, but easier. I'm sorry, I know that's a very vague answer, but unless you give me a more specific scenario, it would be a hard one to tell you. But email me and I'll see what I can do to help. Okay, perfect. Oh, I will have fun in France. Thank you, Claudia. Have a good time, everybody. Have a lovely afternoon, and I'll see you all next week. Thank you.